There's nothing sacred about this handout. It's just the way I used to do it to organize it for the students, because the book would sometimes drive them crazy. And also, I can't remember all this stuff, so when I was doing lab or lecture with them, I could just look down here and look at it. Okay. Hey, it's been about 10 years since I've done this teaching. I did a couple continuing ed courses after I retired. And in fact, you don't have much on the knee in here. And I couldn't figure out why, and it dawned on me. Well, because I think of the hip and knee, and then I think of the knee and the ankle, and there is no reason to do a knee in there. So what I've done is I've put in a board review section for the knee structure, and I have then used a little bit of the ankle section for muscles, and the other muscles of the knee are in here. Okay, gluteus maximus, we sort of talked about it. Now, where does it come from? Hey, folks, don't memorize all the little tiny things it comes from. Okay? You can if you want to. After you know what it does and why it's significant to know where it comes from, then spend your time memorizing. Yeah.
Don't we need to be able to find it, though?
Yes, I'm saying don't memorize all the little places it comes from. Visualize. In fact, you aren't in the PTA program yet. You will know you're in the PTA program when you're at the mall, going to a specific store, and you see this person walking, and you're looking at the way the person's walking, and you follow that person. And you pass the store you were going to. Then you will know you're in the PTA program. At that point in time, how many of you have significant others? They're going to hate you. They don't want to hear about how that person's walking. They could care less that that's a gluteus medius gait. Okay, the only thing they like is when you do massage. Gluteus maximus, where is it? From the medial posterior hip bone press. Medial, middle, hip bone press, down to the sacrum and coccyx. So it's going here. Okay, it's going here. And then where does it go to? It helps form the iliotibial tract at the fascia lata. Okay. The IT tract, the IT band, I'm going to talk about it a little bit later, but let's find it right now. Put your foot somewhere on the floor to lock it. Push out and feel that tight fibrous band going from your, approximately your hip, all the way down to below your knee. Okay, that's the IT band. So the gluteus maximus is helping form that IT band. And then from the posterior aspect of the greater trochanter down the linea aspera. So the muscle is coming like this. What does that mean? Well, it's posterior to the axis, so it is a hip extensor. It's also coming this way and attaching here, so it's a lateral rotator, and it's coming from here to here, so it's also an adductor. Of those, the extension and lateral rotation are the ones you should know the most. Adduction is nice. So my gluteus maximus extends the hip and laterally rotates the femur. Now, what I used to do, I'm not going to suggest it to you because David hasn't started you that way. What we started out in the beginning is we didn't say hip extension. We said extension of the femur at the hip, or extension of the pelvis at the hip, to identify that both are happening. Now, if I'm standing with my foot planted on the floor, with my weight on my foot, like this, what's it going to do? Which of those? It's going to, extend the pelvis at the hip. When I do this, it's still the gluteus maximus working. Now, I got my foot locked down there, so rotation isn't really very possible, is it? Especially if both of them are down there. But if only one is down there, then it becomes a hip pelvis extensor at the hip, but it also can laterally rotate. Okay, I used to do lab exams. One of the things is I'd invite some of the pre-students in to come in and be subjects. Let them know what they're getting into. Actually, I had a young lady and a young guy one time, and the gals and the guys in the class voted that I should invite them back several times. The guys didn't know that the gal was a lesbian. But she was still pretty darn good to look at. Okay. Is this femur lateral rotation or medial rotation? Everybody sees that. Even though the foot is going in, you don't look at the foot, you look at the femur. Okay, very good. You might get that right on the test. Okay. Okay, what does the gluteus maximus do in walking?
So was it propels?
Gluteus maximus do when I'm walking?
Well, it's going to propel you, but it's also going to
Is it?
stabilize you.
How's it going to propel me?
Because you're going to be extending.
It's going to propel what of me? My femur? It's going to, I hit heel strike. No, I don't. That hurts. I hit heel strike, and then what does it do? It pulls me forward. How will I walk if it doesn't work? What happens when I'm here? What's gravity doing? Let's be a little more specific now. It is what of my what and my what? Gravity is doing what? Gravity is bringing the pelvis forward, so tell me fancy. It's what? You got your
I'm
saying?
thinking.
Oh, okay.
Shifting your center of gravity forward.
No, it's what?
Posterior
Okay,
tilting the
now tell me in the 3 point. Huh?
Flexing the hip at the pelvis.
Flexing the pelvis at the hip. If I don't have the gluteus maximus, what's going to happen? I'm going to fall forward. How do I fix that? Huh?
You do the same thing with the other leg.
Strengthen the glutes.
No. Okay, I'm not talking about how do you fix it. When I'm walking, how do I take that into consideration? Folks, how many think muscles are smart? You think muscles are smart? What has the muscle told you what to do recently? What's smart?
The brain.
The brain. The brain doesn't think muscles. The brain thinks movement. Now, what do I do if I've got a weak gluteus maximus when I walk? How do I keep my pelvis from flexing? We've talked about it today.
You tilt your upper body back.
Huh?
You lean back. You tilt your body.
Bring my
Torso.
pelvis into extension so that gravity is pulling back, and I use my what to keep me from falling forward? Not all the quads. I might use the rectus, but it's not the best choice. My hip flexors anyway, and the joint capsule. Because when I'm back here. Okay, so now you got an idea what the gluteus maximus does. Now I'm not supposed to be talking about gait, but I don't know how to talk about these muscles without talking about gait. And I'm only supposed to talk about normal gait. When I was taught, in the summer, we talked about normal gait looking toward abnormal. In the fall, we talked about abnormal looking toward normal. I used to teach everything except stuff at the end 3 times. Boy, was that boring. Okay, so my gluteus maximus is here, preventing me from falling forward and eventually extending both the femur and